This video is going to be a review of a musculoskeletal assessment. Remembering this involves assessing muscles, bones, and joints, both structures and function. And to start the assessment, you also want to introduce yourself, explain to the patient what are the things to be done, and then a couple key points before we start. If your patient can stand, you can perform active range of motion in the bed to the best of your ability. If they can perform active range of motion, you can use passive movements to help them through those range of motion exercises. There's three main areas we need to assess: the spine, the upper extremities, and the lower extremities. And for each one, you'll inspect, palpate, and perform range of motion. So to start assessing the spine, have the patient stand in front of you with their back towards you. You want to inspect and palpate for the spinous process, which should run vertically in alignment. You also want to look for any abnormal lateral curvature, which could indicate scoliosis. Then you want to look at the patient from the side to assess for kyphosis or lordosis, which is just exaggerated curvatures. Next, you want to do a range of motion. To check range of motion of the cervical spine, have the patient put their chin up and down, turn their heads left and right, and then put each ear to shoulder and the side. So next, we're going to move on to the extremities. So for each joint you assess, starting at the shoulder, you want to inspect for the muscle size and shape. Is there any atrophy? What's the skin color and condition? Any redness, swelling, or masses of deformities? Then range of motion for the shoulders involve abduction, adduction, forward motion, backward motion, rotation, and shrugging. You also want to palpate the joint during range of motion. Is there any heat or any crepitus with movement, and of course ask if there are any pain. Now you're going to repeat the same inspection and palpation for the elbows, taking them through flexion, extension, supination, and propination. Then the rest, flexion, extension, supination, and propination, and of course the hands through flexion and extension, all the while inspecting and palpating the joints for any abnormalities and asking for any pain. Before you move on to the lower extremities, you want to do the same assessment on the other side, inspection and palpation for the elbows, shoulders, and wrist, and also the hands. To test thoracic range of motion, have the patient lean side to side and twist and left and right. You can demonstrate this motion if it helps. For lumbar, have the patient lean back slightly. Just make sure that you are there to support them. All of this should be done smoothly and without pain. Then you're going to check the knees for flexion and extension. Make sure that you're feeling for crepitus while they're moving through that range of motion. Then you're checking the ankles. They should be able to dorsiflex, plantar flex, supinate, pronate, and rotate. And finally, they should be able to flex and extend their toes as well. Now we also will do strength for the legs. Now we also will do strength for the legs. These are often done best sitting or sitting on the edge of a bed. So have them push against your hands, pull against your hands, lift and lower the legs. Again, all against resistance. So if they can perform all of this, things, then they are 5 out of 5. Alright, well, that's it for this assessment.